A hearty good afternoon and
Hello.
welcome to this session about cryopreservation, a boon for cancer patients. We are glad to have Dr. Nikita Patel among us today to help us understand the topic. She will take us through that and more in this session today. Doctor, you have the stage.
Thank you. Hi everyone. Good afternoon. Today I'm going to talk to you all about the main. Now it's like a cancer has become like an epidemic. If you see, there's so many patients. As we are sitting in Apollo Hospital, I see a lot of young boys also, and before they start their chemotherapy, they're sent to us to freeze their sperms. So we do both. So we are so lucky as we have both the options. Freeze the oocytes. We have done even in a 17 years old girl. We froze her eggs before she could start her chemotherapy. Recently, I have done frozen and embryos for eggs for a 26 years old who was going through. She had a breast cancer, stage 2, stage 3, before she started her chemo. So previously, we did not have these options of cryopreservation. So it's actually a boon for cancer patients. As what would they do after chemo once they're completely cancer free and the sperm count has gone down to zero, or eggs, we do not get any more of oocytes. It's really depressing for such, because we have seen such patients coming to us too. So here, what do we have? A lot of doctors who, because when before starting chemo, they come and they refer to us. So we do the egg retrieval. So they go through the same process like an IVF. They go for 10 to 12 days of injections, and after the 12 days of injections under anesthesia, we retrieve the eggs. So sometimes we don't even wait for the periods to start, because they do not have the time. These, before they have to start the chemo as soon as possible. So what do we do is, whichever phase of the period they come to us, we scan. If there is a cyst, we have another protocol wherein we can start some injections for 2 to 3 days, and then I can start my gonadotrophin. So in approximately, we need about 12 days maximum. Take it as 15 days for you will have to postpone your chemotherapy, and we can at least retrieve your eggs. And we have even given pregnancy to the patients who have frozen their oocytes about 5 years back with us in Apollo. And after that, when she was cancer free, she got married. It was only her eggs frozen. We created the embryos, and she's carrying her own child. So these are the things which is, we are so lucky because of the modern science, the advances in science. We can go ahead and go about in these processes. Male is simple. Even whatever 17, 18 years old, they can come, they give their samples before chemo. Maybe sometimes we take 2 or 3 samples, and we freeze those vials with us, and later we can be used for whenever they are ready for conceiving. And that also we have seen, and we have got results because that sample is good. I had one patient who had went through a bone marrow transfer. Before that, he had frozen 2 samples, and after he was kind of cancer free, he came to me. I said, fine, let me try a fresh sample. In his fresh sample also, I did get some sperms, but the morphology wasn't so good. So I used his frozen sample, and his wife is about 8 weeks, 2 months pregnant now. So we have a lot of results. We have seen a lot of results in these patients. So I hope that the patients should know, or even the before starting the oncotherapy, the oncologist should have a word about the egg freezing or sperm freezing. They will let you know, depending upon what grade is your cancer, how aggressive is your cancer. We can have a discussion, and we can freeze the oocytes or freeze the embryos. Very simple process, doesn't take too long. For the male, it's the most easiest, because they can just come down anytime. Maybe 2 samples or even a 1 sample frozen with us is going to give us results. The samples can be frozen for at least 10 years. We do few blood work before we freezing, like the triple H, VDRL, HIV, HBS, HCV. Everything is fine. There is no other contamination. No serological markers are negative. We go ahead. He gives a sample. In the liquid nitrogen, the semen is frozen, or the eggs, oocytes are frozen in the female. So, like I said, simple process for the female. She just comes, forget the day one, day two, like every cycle otherwise we go through is a process. The second or the third day of the periods, we have to start the stimulation. But here, we do not care about the luteal phase or follicular phase. Whichever day, maybe day 10 or a day 14 or a day 15, we will scan. If there is a follicular cyst, we might have to give her some injections, and then start the stimulations, and we have got good results with these. So do not give up. We have a chance of freezing the embryos. We have the chance of getting you pregnant, which is most important, because this is going to be the Yeah, after maybe even 5 years nowadays, people, even for career, not only cancer, even people who want to plan their pregnancy later, or they do their blood test, simple blood test called as an AMH will give us a lot of answer. If AMH is in the normal range, we know that fine, this patient is going to give me good number of eggs and we are going to get the results. So we can freeze at the right age. It's always better to freeze between the age of 28 and latest before 30 to 34. We have a good quality of oocytes, we get good number of eggs, and like I said, after the freezing, the patient can start the chemo next day itself. There is no problem. She will bleed after about a week of pickup, because we give them a decapeptyl trigger. And complications, yes, what do you feel when I'm giving the injections? If you're young, you might just feel a little heaviness and bloating in the lower abdomen. That's it. And sometimes a little bit of breast tenderness and white discharge. That's it, not major complications. During the procedure, yeah, it's like how you go through a transvaginal sonography. On that transvaginal sonography, there is a needle attached. Through that needle, when we enter into the vaginal fornix, with the needle, we retrieve all the eggs out, and it's given to my embryologist, who from the fluid will get how many eggs we can see, and we will freeze those oocytes as a backup. So this is the whole process of an oocyte cryopreservation. And like I said, the sperm cryopreservation is very simple. The patient comes here by the method of masturbation. He gives his sample, and we freeze those good samples about in 2 or 3 vials, or we might even ask him to come for the next day giving a sample, because depending upon what chemo, because most of the chemo drugs do affect fertility. And as we have all the science favoring that we can freeze and you can use later in life, like I said, even till 10 years, they're good to go. We don't have to rush, let the treatment get over, you can be healthy, back to routine, and then we can think about transferring the embryos back. If you have to go through and ovarian cancer, so in that case, if one ovary is fine, we even do the ovarian tissue freezing, not only the eggs. If we cannot retrieve the eggs, sometimes one ovary is affected by cancer cell and the other ovary is fine. What we do is, during the process of removing the uterus and the ovary, we take the ovarian tissue, we make the small strips and freeze the ovarian tissue. So that's the future, wherein we don't have to go through a whole process called, for the 12 days of injections. We can just remove the ovarian tissue, take those, make it into the thin stripes, and freeze that tissue. After some time, whenever you want to go ahead for, if you've decided for the process, we can put that tissue back in vivo inside the body again, and then start the stimulation, retrieve the eggs. So it's in because one patient I had with the ovarian cancer, wherein of course I couldn't stimulate her because of the ovaries had been affected. Therein, the other ovary which was not affected, we removed that ovary, we made it into slices, and left the tissues with us. So we will be going through the later, once she's cancer free, we will go ahead and try to stimulate her with her own ovary, so we can give them their own genetical child. Because these, if the patient is young, like I said, if the AMH is good, her hormones are fine, we have a higher chance of giving them pregnancy with their own oocytes, with their own gametes. We don't have to go ahead with using donor sperms or donor eggs. And yes, if sometimes patients have to go through an uterus endometrial cancer, if she has to go her ahead and remove her uterus, at least we have their own eggs of hers. So she'll be the biological child. Somebody else can carry the pregnancy like surrogacy, but at least the oocytes, the gametes are hers, her eggs, husband's sperm. So we have their own embryos, which will going to give us the pregnancy. So do not give up. Talk to your fertility specialist before you start any chemo or any other treatment for cancer. At least you have a chance of freezing the eggs and the sperms. We can give you the pregnancy later life, and we can hope that with your own gametes you get pregnant. If any questions, you can put it on the Dropbox and I can answer your questions. Otherwise, I think this is a gist of how do we do the cryopreservation in cancer patients, and even you can do cryopreservation of oocytes. Otherwise, too, if you think about postponing or delaying your pregnancy. So, all the best to you all, and thank you for having patient listening. Thank you.